So I think some of the biggest issues with, and I don't necessarily think it's issues per se, but because of COVID, there was this huge burst of um, interest in people wanting to know about ADHD, wanting to know about the diagnostic process, wanting to get evaluated and treated. So the information about ADHD just kind of skyrocketed, which has been great for reducing stigma and introducing that this is a problem that very much exists in the adult population. But it has been difficult because you're also counteracting a lot of incorrect information that's placed on social media and placed in even in reputable sources. There could be some information that's coming from a lived experience, but it's not necessarily diagnostic. And it can make that treatment process a little bit difficult, because then when people are looking at their own internal environment and they relate to something that they're seeing, they can grab hold of that and become so entrenched in that they feel like this is unequivocally what my diagnosis is. And when you're dealing with that as a psychiatrist, sometimes what the patient is seeing and what you're seeing can be different. And so then it becomes difficult, especially in the light of COVID, because I think everyone has been dealing with isolation and trying to figure out how to manage their focus in a completely different environment, focus and emotional state. And so it has become a challenge to one, correctly diagnose, and two, to, if it's not ADHD, to provide an alternative diagnosis that people actually grab hold of. Because a lot of people are just like, no, I know it's ADHD because I saw this, social media video that was saying that if you, I had a patient who was saying that if I sneeze multiple times in a row, it's linked to ADHD. And I'm like, no, no, it's not. And there's just, it's unfortunate, because with these social media platforms, it's great because it's a lot of information out there and it's breaking down stigma. But there's very little, way to assess if the information is accurate or not. And sometimes some of these bigger videos that are exploding are with wildly inaccurate information. So it's not even a fault of the patients. It's just not, it's not. Sometimes there's information on the internet, which isn't totally reputable.